Start with the award session for pre-conference training participants. This is the training that has been going on between MOH in collaboration with JPEGO, and Dr. Mike Mngoma will proceed over that session. And then after that, we'll have this sponsor address from Glenmark Pharmaceuticals Limited, followed by the introduction to design thinking in pharmacy by Vilgro. Then this will be followed by a presentation by myself. And then lastly, we'll have the panel discussion on innovation in healthcare. So thank you. Welcome, Dr. Mngoma.
Good afternoon, everybody. Yes, my name is Michael Mngoma. I'm a member of NEC. I'm a pharmacist. I'm also the chair of the Education Committee of the Pharmaceutical Society of Kenya. And I'm very happy and honored to be part of this process. So I think I'll just go straight for purposes of time and introduce this session. So the Pharmaceutical Society of Kenya is really keen on developing the pharmacist, and part of that is ensuring that there's continuous professional development as well as getting into other areas. Following the speeches that were made this morning, it is very, very clear that there's support in ensuring that we move towards dispensing and get to provider status, so that we're able to provide services over and above commodities. So as a society, we've had several programs and partnerships with people who are like-minded or people who really want to progress this profession. Part of this has included a program where pharmacists are being trained to provide quality family planning services at the community, in the community pharmacies. These followed several steps where PSK came together with the Ministry of Health, together with other stakeholders, and came up with a program. And this program, the details of it is going to be said by some of the presenters that I'm going to bring to the podium. So, like I said again, pharmacists, we are underutilized. We have a lot of potential. And as regards to the community pharmacy, there is quite a lot that we can do. So, being at PSK, I'm always looking for opportunities. And having the leadership that we have of the president, because sometimes, and I even saw today, we need to acknowledge our president, because he has provided a space where the leadership, NEC, NGC, and other committees are able to do their work. And part of it also allows people to bring in ideas so that we're not on the receiving end. I will go straight to what we did. We had a pre-conference training for pharmacists in the private sector right here in Diani, which ended yesterday. This is one of 6 cohorts that we have trained, where they have gotten skills and competencies around provision of quality family planning services, including injectable contraceptives. So today, we want to present these trainees and these participants who have gone through this training. But before that, I want to acknowledge some very distinguished persons here who have enabled this process. So I'm going to invite the Directorate of Health and Policy Research, Monitoring and Evaluation, Ministry of Health, Dr. Joseph Sitiene, as well as Dr. Isaac Bashir, who is the head Department of Family Health, to come to the podium. So at this juncture, I'm going to invite Dr. Sitiene just to say a few remarks, and Dr. Sitiene is going to invite Dr. Bashir. I hope that is okay.
It's all right, it's okay. Good afternoon. In the absence of the CAS, the CEOs who are here, and I can see Dr. CEO is still around, and others, all protocols observed. Good afternoon. Maybe I should introduce myself in Kiswahili because I'm more fluent in Kiswahili for the purpose of emphasis. Mimi ninaitwa Gimagutra Sitiene. Nafanya kazi Wizara ya Afya katika kitengo cha afya babla, afya ufuatiliaji na afya utafiti. Mmenielewa? Nirudie tena. Nimesema ya kwamba nafanya kazi katika Wizara ya Afya. Okay, naona mtanielewa, wacha tuniongee Kiingereza. Yeah, so thank you very much. I feel extremely privileged to be here this afternoon. Those of you who read the Bible, and I'm told even Muslims read the Old Testament. And if you read the book of Hosea, chapter 4, verse 6, it says, and it's a very, that my people suffer for lack of information. And we are gathered here to share information. And I'm privileged that this is the area that I really like most, because I could hear earlier on in the day, including what the CEO of KEMSA was saying, there is need for information. There is need for information for us to be able to effectively plan and to effectively do anything. So the gathering that is here, definitely you are sharing a lot of information. And I hope that this information becomes useful thereafter. But I'm privileged to sit in a position in the Ministry of Health where information is the center of everything. And I think you are also in that particular space. Pharmacists play a very big role to generate information. And information only comes about when we generate data. Because from data, we get information when we manage the data. However, said earlier today by the chief guest, the CAS, that we don't seem to use that information to generate two things. One is knowledge. We seem to have gotten stuck somewhere that the information we have generated from data does not become knowledge. And in the few cases where it becomes knowledge, we have totally failed, not just as pharmacists, but as a nation, to use knowledge to do innovation, which is the final piece. And other people are using the data that we have to churn out information, knowledge, and they use that knowledge for innovation. So even as we sit here, we should know that we have failed. And the professor here, who teaches in the university, there is something that is missing, that the training that we give our